Hi, I'm Steve Parker, founder and CEO of The Profitable Dentist.
And I'm Gary Cady, founder and CEO of Next Level Practice.
Together, we have over 50 years of experience helping dental practices overcome hurdles and achieve the success they deserve.
We wanted to speak with successful dentists to see what problems they faced and how they overcame them.
So we're teaming up for a road trip across America to showcase practices that have set the bar for excellence.
Join us as we go behind the mask. On today's episode, we're visiting Arlington Dental Group in Upper Arlington, Ohio. Where husband and wife practitioners Dr. Michael Fair and Dr. Hetel Vaidya run one of the area's most successful practices. Running a business with your spouse comes with its fair share of challenges. Today we're going to take a deep dive into the methods they use to keep their business strong and their relationship even stronger.
All right, well, Gary,
Wow.
here we are, Upper Arlington, Ohio.
Here we are, Upper Arlington. Oh man, it's good to be here. But we've done some good Ohio traveling, my friend.
We have covered a lot of back roads, a lot of big practices, small practices. I think they're doing an amazing job here.
They really are.
And can't wait to talk to them.
Let's do it. Well, Steve, here we are again.
Arlington Dental Group, Arlington, Ohio.
Yep,
Yeah.
behind the mask.
Mm-hmm.
We're on a tour of the U.S. We're going into practices and bringing to life real dentists, real situations, real opportunities, and it's exciting to be here.
So far, my takeaway so far is every practice we go into is a little bit different, mm-hmm. and I think that's the great part about dentistry is you can, as a dentist, you can turn your practice into what you want it to be on your personality. So
You bet.
here at Arlington, it's a whole different story than we've had so far.
So it's really cool to talk about, for me, we work with a lot of husband and wife teams, mm-hmm. and there's spouses that work in the practice and outside the practice, but it's really a family business. Mm-hmm. And how do you have this family, this family, how do you be a husband and wife, how do you have that and then have a business and life and balance and the ands, right? The ands.
Yeah.
Most of the time it's or, like I can have this or this. And something has to sacrifice. And in this case, we're grateful to be here with you guys to talk about, we're calling this episode Eat, Play, and Love. All right, so because for us, you really represent what's possible for the next generation of practitioner. You have great vision for the future of dentistry, and you're creating it. And Steve is really, what I love about Steve is he's a trend analyst. He knows where the future of dentistry is going. You work with 125,000 dentists, you hear the stories, and is the solo practitioner with one doc, 4 team members, where do you see the future? What's the pathway that we're looking at here?
So for me, as an observer, I'm not a dentist, so as an observer, I see a lot of different positives in dentistry. You know, a lot of what you're reading here, you'll hear, excuse me, they'll say the sole practitioner is dead. And I don't believe that, but I believe it is changing dramatically. And one of the ways that I think that's changing is spouses. You know, I always say they're sort of married to the practice. So if you know, she's the dentist and he's the general manager, or she's the general manager and building the business and he's the dentist, or in this case, you know, we have two dentists. Those dynamics didn't exist a generation or so ago. So they're very new. 51% of dental school graduates this year are female. That is astonishing. That is a sea change in dentistry, in the market for dentistry and how practices are run. So this particular episode I think is going to be really interesting in that that's what we're going to dig into and dig a little deeper is, you know, when you know, the husband and wife are also co-docs, co-partners, co-whatever, and sort of how that plays out. And you know, what we talked about, Gary, on the way here is rural practice, a medical dental practice. Those are all new models, or models that are changing, and this is one that's changing very, very rapidly.
You bet. So what we're going to talk about is your journey and where you've come from, and you know, some of the challenges that you faced along the way, and then what you've done successfully to create this whole next generation of what we call next generation practice, where it's a brand new thinking, like how to have a life, how to have a business, and how to have it all. So that's what we're going to talk about today. So I'll welcome both of you, and thank you for being with us, and thank you for allowing us in your great practice.
Yeah, we're honored to be invited, and thank you. We appreciate it.
Thank you.
You bet. So listen, how did you become a dentist? Your dad's a dentist, right? So was that a big influence?
That was a massive influence, yes.
Was it forced, or was it arm wrestle?
It was never, growing up, I swore I would never become a dentist. Yeah, that was never in the cards, that was never on the table, never thought I was going to do that. And my dad never pushed it. He loved what he did. Still, actually, only just now has retired and sold his practice. He practiced here until the early 2000s, sold his practice before I graduated from dental school, kind of went all over the place and wasn't going to do it again, and then moved to Tucson, Arizona, opened up a practice, bought a building, built a practice from scratch.
Wow.
And then just transitioned that to an associate. And it was actually really forward thinking. It's big enough to be a group practice,
nice,
to have more than one doctor in there, and that was his journey. But no, never pushed it on me. I really probably came from a place of fear. I was getting ready to graduate from college. I had a commission in the United States military. I was going to have to go drive tanks and blow stuff up, and I got accepted to dental school, and so I took it and ran with it. And so worked for my dad for a couple of summers and realized that I really liked it, and that just kind of brought me to it.
Wow, that's a great story. How about for you?
And then for me, so my dad's a physician, and so growing up, I knew how the medical field was, and life was just, he was always at the hospital working probably 100 hours a week. Wow. So for me, I'm like, I like them.
He's back to 60 a week now.
Oh my.
So growing up, I love the science, I love that medical health field.
Yeah.
So it's one of those things. I remember I was in college, I was pre-med, and my college roommate her brother was going into applying to dental school and med school, and I'm like, dental school, let me give that a try. So I just applied to dental school, and I'm like, well, hopefully I'll like it. So as soon as I started dental school, I'm like, this is great, because you get to work with your hands. It's the art and science, and it was just everything that I had imagined, so loved it.
So we have two great practitioners, and now how did you come together? How did this arrangement work out? What happened? When was the moment that you met?
I think we met the first day or first week of dental school.
So
I sat in the back of the class playing a Game Boy Advance because you can't do that in the front row. And Hetel came in late because she's on Indian Standard Time, which usually runs about a half hour late behind everything. And she sat down next to me, and I was kind of like. And then after that, I probably thought we were dating a lot longer than she did.
We were really good friends, really good friends. He was my best friend, I remember the first semester of dental school.
And I was in love with her.
We studied together constantly. So pretty much the whole 4 years, we were just used to talking about teeth and studying together and going through, our journey into becoming a dentist.
Yeah.
Wow, what a great story!
Awesome. At the end of the show.
Yeah. So for us, it worked. it works because, I mean, that's how our relationship started, was just about, it was with dentistry. So, I mean, I know
That's your
there's some people
connection.
are like, how can you work together with your spouse? It's like, you know what,
it does
works
force you
perfectly
to
for
figure your
us.
stuff out early, because you don't get that buffer of like, you know, if I irritate her in the morning, then I can go to work, and then I have to kind of sit down and be like, hey, remember when I was bothering you 5 minutes ago? We should probably work our way through that.
So you come together, and then I understand it took you on a journey. You're in the military, and tell us about that.
So I paid for my undergraduate education with an ROTC scholarship, having no idea I wanted to be a dentist, and that was terrific training, because it's actually really helped set us up for success in our practice as well. A lot of the early structures that we put into practice came from my military training, and it was very useful as a stepping stone to what we've grown to now. And then it was also terrific because once we got out of dental school, it was great to step into the Army Dental Corps. I had really good mentors. You get to practice dentistry without any overhead. And so you get to see as many or as few patients as you like. You can work really hard. You can do a lot of dentistry and really figure out what you like and what you want to take from it. And that was fantastic. We also were fortunate enough to be stationed in Germany. And so right after we got married, I pulled her out of the country, away from her family and friends, and just forced her to rely only on me. She got to work as a civilian. She got to work as a civilian contractor. We were in the same clinic while we were on active duty, which was terrific too. And so we both just got a ton of experience. Traveled around Europe. We got to do stuff early in our relationship that most people do at the end of their relationships. And so it was just a really neat way to start out as dentists, and a really neat way to start out as a couple.
Great. So you're in Germany, and then that ends, and then what happens?
We had an opportunity. We kind of rolled out the map, and Hetel's sort of a big city girl, and I'm not. We had a prosthodontist, a family friend, who had actually purchased my dad's practice after he had left Columbus, and purchased a bunch of other general practices, and he kept kind of saying, hey, you know, you should come back. There's an opportunity for you, and we agreed to give it a shot. It was actually Hetel wanted to go to Chicago or the suburbs of Chicago, and I was able to do a cost-benefit analysis that showed her we could fly to Chicago on Thursday night every single weekend, stay in hotels, and still come out ahead by being in Columbus. And so she agreed to give this a try. And my family's here, her family's an hour and a half away, and so it made sense. And then once we got here, we started putting down roots, and we really liked it, and have been just really loved it ever since.
Oh, that's great. And you're local to this. You grew up here, right?
I did. I graduated from the high school, Upper Arlington High School, and we practice here in Upper Arlington. And so that's another one. I swore I'd never be a dentist. I swore I'd never come back. And then first chance I got, I turned into a dentist that practices here.
And now you have a family as well, right? You have a boy and a girl, beautiful. And what's that like now? Now you have a practice, you have a family, right? Now what's that like?
It's exhausting. It was, it was a skill set. So when I got out of the military, I thought that I was a total badass. I could build anything out of amalgam. I would put so much amalgam, people they'd be listing to one side when they walked out after the appointment, and I got into private practice, and there was a prosthodontist that coached me, Dr. Doug Goff, and he really helped me see that I was really just at the beginning and at the foot of the mountain in terms of clinical excellence and what we can learn and what we can do there. And so it was the first 6 months were very, very eye-opening, very humbling, and it was great because it started me on my journey to figure out what kind of dentistry do I want to practice and how do I want to take care of people. And so you felt like you gained a whole bunch of ground, and then you're starting over again. Running a practice that was our first kid.
I was working at a Medicaid office for the first 3 years after we came back from Germany, which at first I'm like, oh, I'm not sure if, but it was just a great experience. I got to do all the endos I possibly wanted to do. So that's one of the fields that I really like, specialties I like in dentistry. So it was a great opportunity for me. And then he was here working as an associate. We bought the practice 2 years after that. And then we're like, okay, now what do we do?
Terrifying.
How do we own a business?
1 January 2011, we opened up all of the checking accounts. There was $0 in them, and then the note at the bottom. So when you logged in, there was nothing, and then the practice note. I had to make payroll that week. I had to drive the deposit to the bank to drop it off to make sure that we had enough money for payroll. That year, I paid myself probably half the time. I moved money from our savings, into the account to make sure that we could make payments there. And it was
We were barely making anything that first
yeah.
year. Yeah.
And it was I mean, but it was an investment in
Oh,
our
yeah,
future, and
absolutely.
it was nerve-wracking. It was a skill set that we didn't have, and we didn't know what we were doing. And so we fortunately, again, we had really good coaches. I'm a second-generation dentist. My father's been successful. He really helped us. We've always had people looking in on the practice from outside, so we've always worked with consultants, and finding Gary was actually one of the best things that ever happened to us, and that came later. But so we always had people helping us, and so we were always moving in the right direction incrementally. But it was just a really hairy time, and it was really stressful in a relationship too. Like there was,
It was just things about the business, owning a business in itself. We had no idea. That's something that they don't teach you in school. So I remember I was Googling and on the internet trying to figure out, how do we do this? What is corporate tax, and what is these things that you just don't even
quarterly
know.
taxes. That we finally got ahead. I was so happy, and then we got hit by the first quarter tax. It's still an emotional scar because it was everything. It was like here's your taxes, and that should be a celebration. Hey, I got to pay tax. That means I made money. That's awesome. And it was just everything was gone. Like all of our cushion was gone. Everything was gone, and that was in the first 3 months. And and I didn't see that coming.
And for
like stuff
him,
like
I mean,
that.
he's doing dentistry. And then you add the business aspect onto it. So that's where I came in. I'm like, okay, well, let me see what I can do with bookkeeping, and that's where I started getting more involved. And I wasn't even working in the practice, so for me, I was kind of standing back. But it gave me, it was a nice way to start getting my foot in this practice before I really started working here. But yeah, learning about the business and all the things that come with it.
And Steve, you see this all the time.
Yeah.
I mean, you see, it's like you're great clinicians, but if you miss that half hour in dental school, I like to say, of leadership and management and administration and marketing and case acceptance and inspiring in a team and doing all that, especially because you have a big vision. Like, you both can just settle in here and ride out the rest of your career and have a nice life, provide for your family and do well. But you have a bigger vision of what's possible, right? And so that creates this gap of like, oh my gosh, now what, right? And so we were talking earlier, and like, what does that bring up for you, Mike? Like, as you go, like, dentistry is going to change. That, to have, well, first, let's give me your like vision of.
It's really even just being able to get to a place where we could have a vision. We were just talking about when we were in survival mode and just trying to get by. And so you get to the point where things are flowing. There's more money in the bank at the end of the month than there was at the start of the month, and that feels really good when you start getting to that point. And we hit a point where it was. We were doing really well. We had everything was. We were checking all the boxes. We were doing all the things that were right, and it just wasn't sustainable. I had pom poms in the front of everybody, bringing everybody along. I was really just doing everything, and it was all predicated on me, and it wasn't sustainable. There was no way I was going to be able to keep doing it. There's only so much dentistry you can do in a day. There's only so much that you can do to carry an entire team. You need more than that. And that's actually where we started our relationship with Next Level, where we even realized that something different was possible. And that's what led us to our vision now before we started there, before we got out of that kind of the mic, I just called it the mic show, where it was just jazz hands, all the, like, you're just going constantly, and so you're always on, you're always going. We got our team engaged, and they started rowing the boat with us and helping us. Hetel became not just somebody that was in the practice, but became a true partner in the practice and matured in your role in there and started really helping. And so that took some of that burden off, and then suddenly you're not running up the hill, you're not carrying everything, and you can kind of take a breath and look around and decide, like, oh, you know what? There's other things that are possible. And so that's what led us to our current vision, and what we really believe is the way that dentistry is going to be practiced is going to change. That you can practice as an individual and you can have a very successful career by yourself, but what that doesn't do is it doesn't let you pass on your legacy. And that's your patient care. How do you take care of this family of patients and community of patients and your team?
What I love about that is that you're taking care of people along the way, and that's how you know it's sustainable. And it's not about you; it's bigger than you. And we're going to unpack this a little bit here, because we're standing at the base camp of a mountain that you're going to climb. Like you said, you said you were born on third base. I thought that was one of the most profound statements ever. That's pretty cool. I'm a baseball fan, and I think that statement really says a lot. And But then there's like all these, I call it FUD, fear, uncertainty, and doubts, right? You're going on a journey that you've never gone on before. And so we're sitting at base camp, and you have this picture. What comes up for you? What's there for you? You know, and we're talking about work-life balance. We're talking about, like, is this going to be more work? We're talking about, like, how do you do it? All those things. Like, what's there?
I guess one thing I have to share right away is I kind of feel fraudulent sitting here because I don't feel like I deserve to be the guy that's talking about this stuff. I just don't. I mean, I feel.
I want to give you a big hug right now, because that's like how real that is. That's amazing.
Well, there's just so much to learn, and there's so many people that have been doing it longer, better, and that sort of thing. And so for me to be talking to you guys about this, like, that's, and for us, I mean, for us to be sitting here talking about our experience, it just, like I said, it makes me feel insecure. It makes me feel a little jumpy.
Good. Good. That's our job, to make sweaty palms. Your palms should be sweaty.
That's what comes up.
That means you're paying attention.
Yeah. And then also I mean, we talk about our vision of what we want it to be. We talk about it with the team. We have no idea how we're going to create it, and to announce it, to talk to you guys about it, and to know that this is, other people are going to get a chance to see this.
Yeah, and that's the contribution you're making, because that's the other nice thing, that an amazing thing, Steve, that I know about them, is they care deeply about people.
Yeah.
And it's not just about you, and that's how you know you're going to be successful, because it's really about being of service to other people. So you were talking about year one, the work that you did, and you know, it's like you got space, you could think, you didn't have like buckets that you were trying to get rid of water, and you could, you know, when you get to that spot, that's a very powerful place to be. And so running a business, you spoke earlier, like, that's a difficult thing for clinicians. You're not trained down that path, right? So I wanted to bring up some statistics that I think would be really cool for you to see. In 2017, it was the first year we were measuring. Before that, it wasn't even being measured. The treatment presented and treatment accepted wasn't even being measured. Isn't that interesting? Like, think about that. You know,
our primary metric was how much money is in the bank after I pay the credit card at the end of the month.
Exactly.
Because the note payments came out on the 1st, and then after that I could do math on what we could take.
We're like, okay, it looks okay. We're going to be okay this month.
Well, 99% of dentists are looking at their bank account for their statistic, and you now know the problem with that. That's a downstream statistic that is very difficult to change, because once it's there, it's there. It's what happens upstream from there. And once you get your arms around what's happening, especially in dentistry, because we have the gift of reoccurring patients coming back. And if you can look at some of these numbers, this is really where you get your space. So we look to decentralize the doctor, put it in the team's hands, and through the 4 pillars, the P's that we 4 performance pillars, which are the purpose. And we're going to talk a little bit about purpose, because if you have process without purpose, it doesn't work. You know, if it's just about systems and it doesn't have a high purpose behind it, it doesn't have the same value, right? We learned that together. And then we have to talk about people, and then we talk about platforms. So what I'm giving you is the platform of analytics that allows us the behaviors, we call it the behavior dashboard, that allows us to know the behaviors inside the practice. Obviously, if you're not tracking treatment presented and accepted, there's no possible way you can run a business now. But back in the day, you were like, hey, bank account's the way we do it, right?
You go home happy.
Yeah.
So I'm going to give you before and afters. You ready? This is 2017. 92,000 presented, 72,000 accepted, right? That also indicates you were doing more single tooth dentistry, right? Like more of that type of work. High case acceptance percentage, like awesome. But you know, going forward, just in July of last month, you were at 171 and 80 and change in case acceptance. So, you know, that's a big increase. And you, of course, you're not selling dentistry to people. Like, this isn't like you're pushing and forcing. Like, what happened that occurred, that kind of increase occurred?
That's a terrific question, and there's a long answer, and I'll give you the short answer. And so one is we get really good coaching to tell us what to look at, and that starts you on that journey. One of the biggest things was clinical calibration. As we sat down as providers, and Hetel and I, we took intraoral photos, radiographs, pre and post-operative radiographs, pictures of teeth that at before diagnosis and then after excavation, and we went through all of this and we said, this is what I see, what do you see? And we established what's our standard of care going to be. And then we built that into a document, and it's a living document, and then we rolled that out with the team. So now the team is looking, and what they see and what we see is the same thing. And so now we create a standard where we have patients that we know are going to say yes. No matter what you do, they're going to say yes. We have patients that we know are going to say no. at 4:30 on Thursday, you don't want to see the dentist anymore. You're tired. You don't want to diagnose it. You're like, you know what, we can keep an eye on that for a little bit longer. And so what changed is we established a standard of care. Once we had a standard of care, now it's no longer just predicated on what I see or what Hetel sees. The team can call us and say, Dr. Fair, we talked about an amalgam that has a stick with tug back and a clear break is a tooth that needs restoration. And so now it's not all on us. We have people helping us maintain our integrity and maintaining that standard. The other change is then coming from a place of fact. When we talk about the practice, we as a team work in the practice during the week where we serve our patients and serve each other, and then we work on the practice as a team in our morning huddle and during our team meetings that we have weekly. And we look at those numbers and we can say, hey guys, our presentation goal is this, and we're low. Why are we low? And then we can go back and look at patients and say, that patient such and such, had this and this opportunity to get healthier, and we didn't talk to him about it. What happened there? Dr. Fair was stuck, CIREC was down, we're running behind, and so he ran out before we had a chance to even talk about anything.
Really, and the highlight there is everyone on the same page, and you're speaking team, and you're decentralizing you. So it took something as a practitioner for not having to come from you. It still comes from you, but you now have it mapped out. And we see this as the biggest barrier for scaling, because what happens is it becomes about the dentist, Steve, and what in his or her mind, and then hoping that everybody else is aligned. So one of the tools that we put in was management by agreement, and management by agreement is a game changer. It is who, what, and by when.
It also works with children.
Yeah, so beautifully. So this is an agreement for what is a healthy mouth in your practice, and what are the soft tissue and hard tissue standards of care. I was also looking at your hygiene case acceptance. You started at 8,000 and got 7,000 accepted, and now you're at double that. So it goes back to getting agreement, decentralizing, and creating the practice as the deliverable, not the individual as the deliverable, right? Because if it's relying upon you, you can't get to the top of the summit.
The verbiage that we use in our practices, and we tell this to patients and we tell this to team members, is that we're about outcome, not ego. And so, for example, when we get new patients, we always, like, if they've moved in from someplace, or we get patients from specialists on a regular basis, which is a compliment for our practice. And what we tell people is, like, if you want to get a second opinion, if you ever want to talk to somebody about this, that doesn't hurt our feelings, that doesn't bother us. Like, we want you to be healthy, and we want you to get the treatment that's going to make you healthy, and that's how that works. If one of my hygienists or if one of the ninjas says, hey, Dr. Fair, I noticed that there's on this radiograph, it's something that I've missed, in front of a patient, I'll say, thank you, that's a really good catch. I missed that. I appreciate you pointing that out. Yes, let's talk about this and let's see what we can do to get this tooth healthy. And it's about getting patients healthy and taking us out of it. That was a tough shift, especially because, again, at the beginning we were coming from the Mike Show, and I really liked the Mike Show because it made me feel good about myself. But that couldn't get us where we wanted to go eventually.
So I want to really highlight that point right there. It's not until the dentist identifies that they're coming from a place of identity. Because when you, and I went through this myself, as long as it's you, the identity, you have a job in a business. You're going to be an owner-operator forever.
Self-employed.
You're self-employed. You got a job, a glorious job. And what you looked at and learned early on, which I really admire, is it can't be about me. And the quicker I can decentralize myself, and just highlighting those standards of care, the healthy mouth baseline, those elements allow the scalability for the patient education to happen and not have you in the center of it. Because you can plug and play the dentist at that point, because the team has it.
Well, and then the biggest thing there is that you're now delivering consistent care. I mean, the point, like, we always talk about numbers and outcomes and things like that, and that's another thing we talk about in our business routinely is that we talk about numbers, and numbers in a dental practice are like blood and oxygen in a body. They're absolutely necessary for survival, but they're not the point of survival. And so, but really the point is to get patients healthy and keep them healthy for decades. How do we make sure that they can talk, smile, and chew for life? That was sort of the foundation of our culture and where we started. And this just builds on that. And so by getting the dentist out of the way, like you said, we can now plug and play. When a new dentist joins the practice, we can sit down and say, here is our standard, what do you see? And then they can help us elevate our game, or we may be able to help them elevate their game. But no matter what, the patients are getting the same care regardless of provider they see. And that's the biggest snag for a group practice and for the future of dentistry, is making sure that no matter who's taking care of this person, they're going to get the care that they deserve at the level that they deserve it.
And without a standard of care, and healthy mouth baseline, you get what we call the associate cliff. And the opposite happens. We have hundreds of dentists, thousands of dentists that go, I failed with an associate, because they don't realize, they go, the associate needs to go out and market themselves. They need to, sell dentistry, and they leave the associate out to dry, versus saying, I have a business and I'm here to replace myself so I can scale this thing. And that's a very different mindset.
And we should qualify this by saying that we haven't done it yet. We did it with each other, and that's nice.
Step one.
That's step one. But it's also nice when you know that she's not going anywhere if I tell her let's do it this way, and vice versa.
Right, but you can practice under there. But you have a chassis now. You have a business model now. You have a game board now that is scalable all the way down to the name of your practice. Hetel, we were talking about, making the decisions to put your name on there. Again, going back to identity thinking. If it's identity thinking, then it's your name on the door. But Arlington Dental Group, which has been here since the 70s, you said?
The Arlington Dental Group came into being right before we got here. So we had in 2007 or 8, and then in 2009 I started in the practice, and then we bought it in 11.
And at that time, I told him, I'm like, oh, we should change it, because it should be your name. It should be Fair Dental or something along that line. But now we're really happy that it is.
That you don't have to undo that.
Same, yeah.
But you've been in a curriculum, you've been in a learning process that takes you from dentist to a complete health dentist. So that's step one, and decentralizes you. Can you just talk a little bit about what a complete health dentist means to you? Let's start with Hetel, please. What does that mean to you?
Well, it's educating our patients on the oral systemic connection. That's something that is not taught in dental school. And it's not until I think even just 5 years ago when we started with Next Level Practice that we really started to understand the oral systemic connection. So it's educating our patients, and the patients aren't just coming in to get their teeth cleaned. They're not just coming in to get fillings done. They're coming in to prevent systemic disease that starts in the oral cavity.
That's great. How about for you, Mike? Can you add to that? Is there anything else you want to add?
It was a really big shift for me, because again, as a second generation dentist, I believe in dentistry just on the merits of dentistry, and am obsessed with delivering high level care at the as good as we can possibly do it, day in and day out. And I always felt like that was enough by itself. The biggest thing that came with the Complete Health shift for us was a sense of urgency in how we take care of our patients. It's important that they be healthy. It's important that they embrace this care. And what's been so neat for us is watching a lot of patients, once they accept their dental care, it's so easy for them to say, you know what, they made a shift, and now they're looking at their diet, and now they're looking at their blood pressure, now they're looking at the stuff that we talk to them about and start that discussion. It's a safe place, and we get a lot of time with them. I mean, I think a physician gets 3.5 to 6 minutes, somewhere in there, and
Yes.
we get to talk to them for 15-20 minutes. Our hygienists and our ninjas are with them for hours. I mean, it's terrific, and so it really changed how we look at it. It gave a sense of urgency into taking care of our patients.
And really a sense of purpose that was higher than just doing dentistry, right? A sense of purpose, knowing that the contribution, you're still doing that work with a handpiece, but the contribution of that work, or a scaler, the contribution of that work has many folds for the value that you're providing, right? So that's like the pillar of purpose. And then we spoke about process, and that starts to decentralize you. One of the things that I don't know, you guys control freaks? I'm a control freak. Hetel might be.
Just a little.
Yeah. You're a little freer around that, right? Wouldn't you say?
I think the best way to find out if you can trust somebody is to trust them, and I'm willing to give people as much latitude as they need.
But ultimately, we have to put some form of control in a practice. But if there's not a business structure, you can't let go and still be in control, and then you have to be controlling as a way of being, and that gives you no space or freedom. And so that's what you described. We gave you this structure, and now you can know measures and accountabilities and understand, how to run a business, right? So that you became an entrepreneur at that moment. And now you're working on becoming a dental CEO, which has a whole nother realm of responsibilities to it, because now you're an enterprise owner. And you've been, what I love about you both is you reverse engineer things, and you prepare before you have to repair. And I love that about you. You know, that's what makes you unique. So you're in preparation for this climb up the mountain. You've done the work, you've done the exercise, and now it's time to scale. And you know, when we talk about being a dental CEO, and I love that we have a once a month meeting about the 3 elements of being a CEO. If I quiz you on them, will you get them right now?
I will get them right
All
right now.
Good. All right, so I'm putting you on. Good. So now you move from dentist to complete health dentist, entrepreneur. Now you're preparing to be a dental CEO. You've been working at that for a couple years now. What is that?
That's managing 3 things. It's culture, solvency, and vision. Giving everybody the vision of where we're headed and a really strong why, ensuring that the business is running with solvency, which is actually Hetel's primary area of concern, and then maintaining a culture. And culture is the most important thing, because culture is when you have snags and problems, culture is what can carry you through that.
Yeah, and let's unfold culture, because let's get to another pillar called people. Having the right people in the right places doing the right things. You have a hygienist who leads your team? Like, really? Like, is that so?
She has the right personality and was the right person to take that over, and she was our first team leader and that was the first person that was helping us row the boat. And when we stepped into turning this into not a dental practice, but into a dental business, and that was just a godsend.
Yeah, she's a special lady.
She is.
Yeah, she's one of a kind. She really is. So we're going to talk about culture, and you mentioned the importance of culture. Now that you're an enterprise owner, a CEO, and you're looking at, okay, I have to have a picture for the future. I got to have solvency, and we got that handled here, CFO, right? Mm-hmm. And then we have to look at culture, and you know the quote. I forget who said it, but culture eats strategy for breakfast.
Right.
Meaning, you could have the best strategy, Steve, right? Mm-hmm. But if your team is not fully on board and bought into the why you're there, I mean, you can't make change, you can't grow. It's difficult, right?
Mm-hmm. Oh yeah, absolutely.
And we see it all the time.
Yeah. So how do you guys handle that?
We just handled that actually in this last year. We've always had a very strong culture.
Yeah, for the last 6 months, I mean, we took our eyes off the culture because we didn't think we had to worry about culture, because like, we've got great people. We thought they were well taken care of, and we took our eyes away from it, and our culture really affected our practice for the 6 months.
We had team members leave. If you want to measure your culture, it's how you feel on Sunday night. Mm-hmm. When you're getting ready, like, what are you thinking about going in on Monday morning? And if you're going in to slay a dragon, or you don't want to have to deal with such and such, or think about this, that, or the other, then your culture's broken. And that was the first time we hit that, and it really affected our practice. We were down last year for the first time since we've been owners, and that's a really hard thing to face as a business owner. And then you start looking at the whys, and it came back to Hetel and I and how we were leading the team and what we were doing.
It's easy to put blame on other people and the team and the systems, but what happens is you're gifted as you go along this journey of entrepreneurship and building a business. You have to look in the mirror quite often, and these were some of the things that I had to learn the hard way. And I've gone through the pain, and I always keep going through the pain so I can give it away. And it was awesome to watch you.
Well, you just think like, if we get the right person, or if we get, or you know what, let's make them watch this video, or if I get these new burrs, everything's going to be fine. And that's not how it works. You really have to do it yourself.
So there's a lot of layers to this. As a CEO, those 3 things: the vision, culture, and solvency. It's a different job that you have, and so you have to free yourself up so you can do that on a full-time basis, and that's where you're going, and that's what I admire about you.
That's one of the biggest struggles we have, is finding space for that, because it's very easy to just do dentistry, and we have days where you're at the schedule and you're counting patients, like, what's it going to take for me to get out of here, and that's not growing the practice, that's not serving your vision, and so it's a really hard thing to keep track of, and we still don't excel at creating that space. But that's why we want to grow, is so that we can still have those times to take the step back and have those thoughts.
I want to dig in here, Mike, because I know you personally through the work that we've done together, and you and I share being humanists. Like, there's 4 different types of leaders. There's the competitive, there's just like A to B, where's the finish line, I want to win, they don't care about anything else, that's the game. Then there's the humanist like you and I, we care deeply about the people that are around us, people first. And then there's the methodical, right, that has, if I give you 5 steps and I only tell you 4, it's like nerve-wracking, right? So dentists fall in under humanist or methodical and right now the methodicals are what's the fourth one? The fourth one is spontaneous. That's the one that has, you know, short attention span and is the fun one, right? But they're outliers. The competitives and the spontaneous are outliers, and 75%, because we did this scientific study through the Myers-Briggs, 75% of dentists either are humanist or methodicals, primary, secondary. Awesome, because that's what it takes to be a dentist, right?
Say methodical humanist.
How's that
Right,
working here? Yeah, yeah.
it's perfect, right? So, but we're all of everything. There's a little bit of everything in us depending on the situation, but I'm talking about the primary. And you and I went through the same thing. Like, it's almost like I go through it and we talk about it, and I can speak from like my experience, and I see your head nodding, and you always go like, okay, I get it. And so let's talk about being a humanist leader, because a humanist under pressure acquiesces, says yes, doesn't want to deal with confrontation, right? So let's talk about that for a moment, Mike, because you're growing, and you can be a certain leader under those conditions. And then when it's time to start moving to, you know, big boy leadership, what happened?
For me, it's confrontation. It's having line in the sand conversations. It's holding people accountable to the agreements that we've made. You know, I as a humanist, I don't want to hurt their feelings. I don't want to ruin their day. I don't want to make them feel bad about themselves. And so, you know, not corrections, but just everybody's agreed to practice at a certain level, and holding them to that standard is what we've agreed to do. And so, really internalizing that I'm helping somebody when I coach them, or when I get them to meet an agreement, I still struggle with. Because I don't want them to be upset. I don't want them not to like me. And so that becomes really hard.
So for this, we designed this whole program for non-confrontational people. And if we give you a process to follow, there was two things that you said that I want to bring into the loop here, so people can get an understanding of the work you did on a granular nuts and bolts level. You used the word line in the sand. So that's a process, right, that was created. And the line in the sand has 5 steps. So I just want to review those again. So first, the line in the sand is, if you're dealing with, why do we have the line in the sand conversation? It's because there's something called the Karpman drama triangle. And it's a thing in psychology that in any group, there's the perpetrator, there's the victim, and the rescuer. And it happens in families, and it happens in businesses. And it's like, now you know about the Karpman triangle, you can now see it in a practice. The only way to get out of the drama triangle is to get consent. And when you're a humanist, you want people to like you, so we don't stand for something, and then what happens is it kind of floats around and we get flippered around like a pinball machine. So the line in the sand is a process that gets people to consent to you being the leader. So what you do is you have the meeting of team members. First thing you do is acknowledge them. So you come from your heart, and there's always good things that are happening, and you acknowledge them. So acknowledgement is important, because then people really feel like they're validated, right? Step number 1. Step number 2, taking responsibility as leader in the practice. And this creates a vacuum, because most times leaders go to other people and put weight or blame in them. I did that for years. I found that just doesn't work. So why keep doing that? But when you responsibly take responsibility, you create a vacuum. Because the minute you say, I'm taking responsibility for being a leader in this practice, and then you tell on yourself, like, I haven't kept I would just acquiesce, I would show up late, and you own your role in the matter. Then you establish the line in the sand. What got us here is not going to get us to where we're going. And I've been using the metaphor of climbing up the peak. You don't climb up the peak straight to the top. You have to go through the journey of finding the way. You have to find the way. And so it takes something, but when the team's offline and they haven't consented, you don't want to be pulling them up by a rope yourself, because you'll never be able to scale like you want to scale. And you will never have the culture that you want to have, right? So that line in the sand is, what got us here isn't going to get us where we're going. Do you agree? Yeah, we're like, now you're not like you're going, hey, do you guys agree? Like, we're not going to be able to get, our job is to have 3 practices. They're already engaged in that. So, but if we just keep running on the treadmill here, we're not going to get there. And then you state where you're going. Here's what I need from you. We're going to be implementing the complete health practice. We're going to begin to look for multiple other practices. That's going to be good for you. And you speak to the 4 personas: the humanist, wants to know we're going to make a bigger difference. The competitive wants to know we're going to go from A to B faster than we're doing now. The methodical wants to know, and we're going to give you training so that you're going to be certain when we go forward. You're not going to be left behind. And the spontaneous wants to know we want to have some fun along the journey. So you say those 4 things, and then I'm asking you to join me because where we are is not going to be where we're being, and I want you to come with me. See, now it's not like obligatory for the person. They get to choose, and it's a full choice. And then here's where the partnership comes in. What do you need? And they say yes. If they all say yes, because a lot of them will say yes, Steve,
Yeah.
but they might mean no, right? Or you don't know. And then you say, hey,
Yes.
yes, 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 exactly,
I'm gonna
yes,
do
yes.
this with you.
Yeah.
Right, but here's the gap that once you get this playing field and this culture set up, it's you stop playing golf on a football field. See, because you as owners want to grow to 3 practices, they don't want to lose their job, right? And you're threatening them because you're giving them new things to do and new ways to operate, and so that's a threat. But when they see what's in it for them, know that it's safe and they're supported, they're willing to take the journey. But sometimes you have to step in there and ask for that consent, and you might have to do it 2 or 3 times, which you had to do over the years, right?
Is
We
what
just
you
went
do.
through the same thing too. Yeah.
Yeah. And then, well, it's also, and what's also important is that there's every single team member, their attitude matters. People can have bad days, but you're never going to see a C+ turn into an A, and you're always stuck at that C+ if that's what you're at. And we've lived through this a couple of times. And that, again, as a humanist, it's really hard to people want to be good at their jobs, and a lot of times when you set them free, when you let them go, they're relieved.
Yeah.
And so are you, and you don't even realize how hard you were working to keep that person there.
And how long it took you to actually cut that.
Yeah, right.
Yeah. And so no, when people decide that they don't want to go along, it's usually better for everybody involved.
Exactly.
And it's scary, but it's typically a relief.
So we're talking about culture is senior to everything. So now you've set this, they've all consented, now you get the lone wolf cruising around, doing whatever he or she wants to do, and you got somebody off. Then, again, being a humanist, you want to acquiesce, you don't want to kind of shove it under the rug, and that's when we have to bring in the crucial conversation. That's the distinction that we created, the tool, the process that allows you to come face to face with somebody, but not disempower them, but actually tell the truth about it. And if you allow that person, everybody's playing to the low woman or man, but when you confront that and have a step-by-step process for having a crucial conversation, now as a humanist or a methodical, you know how to plan your words and conversation. Because I'll tell you, if I peeled off everything, the thing I hate most is confronting a team member or having to fire a team member. That's probably a 10 out of 10, that I absolutely abhor. Maybe because I'm a humanist. I mean, Steve, do you find that is that true for you?
Yeah, it's true for me personally. No, I've never really worked for anybody else. I've always worked for myself. So, you get into those situations, but yeah, it's very difficult to have that difficult conversation. It's tough to fire somebody, or it's tough to come to that conclusion. And I think you just said it. It surprises you how long it took, but it also, in my experience, it surprises you how much better it is afterwards.
Dr. Fair Sr. always said you never regret letting somebody go, you regret how long it took you to make the decision.
Yes.
Yeah.
Yes. Yeah. Of course, it's great.
Good
It's
lesson.
Great wisdom your dad has. It's really cool. So as an individual practice, you're a top 1%er. Right, when we first started, you were doing just about $1 million. You finally hit that. It's that special magic 7-figure move that happens, right? And that was about 4 years ago, 5 years ago, and now you're on target to do almost double that. Which is congratulations. That's a big deal. But you have higher sights set, and we're going to talk about associates, and you're going to talk about associates from a clinical standpoint. I want to talk about associates like. The main thing that we need to do is the big risk for scaling is not having the practitioners to deliver it. So knowing that you have this growth potential there, so when you buy it, you make sure you have enough space to grow, like the physical space, but also the patient-based space.
And so my thought on an associate out of the gate is that the associate needs to benefit from their time in the practice, and very clearly. And so the way I look at that is when they join the practice, for however length of time. In my mind, I like the idea of a 3-year commitment. But in that 3 years, they're going to learn how to become a better clinical dentist, They're going to learn how to be a leader within the team and what that looks like. And they're going to learn about business. They're going to learn finances, personal finances and business finances. And so if they stay with the practice, then awesome. If they made it through that 3-year thing, they're mature, they may have an equity opportunity, they're going to be financially and intellectually and emotionally ready to make that investment. If they move on to bigger and better things, dentistry is going to be better for it. They're going to look back on that time and think, I'm glad that I was there. I learned a lot, I got a lot out of it, and then they can move on to bigger things and take what they learned and make dentistry better and make other people healthier. And so everybody wins with that sort of a thing. And so when the associate comes in, I think a lot of times when there's failure, it's because there's not clarity on what are you doing, why are they here. If you're hiring an associate because you don't want to work nights and weekends, that's not a great deal. Right. I mean that doesn't work. If you're hiring an associate because you're looking because you're tired of doing dentistry, you don't ever want to do it again, that's probably not a good deal. I think you need to be really clear on what you want, and then that person will come.
It's great. And then also adding analytics to it and a team. So when the team around that associate is supporting the associate, and they only have to call balls and strikes, the way you have your healthy mouth baseline, those balls and strikes are called, and the standards of care, those are all like laid out. So that's why it has a big benefit when you do that for your team about your standards of care and having that healthy mouth baseline. Now all of a sudden that's the keystone or foundation for the conversation, because then the dentist can call balls and strikes. You might be doing the dentistry, but they may be in the recare visit doing that recare visit, right?
And if you can change the context to be about outcome and not ego, it's the outcome of a terrific restoration, it's the outcome of a healthy patient, then when you see something in hygiene that's not ideal, or if you deliver something and it's not the best that it could possibly be, it becomes a celebration of your culture, a celebration of the integrity of the practice for everybody to look at and be like, hey, that didn't work, that's an ugly baby, we get to fix that, let's go ahead and get this patient back in. And I, like the verbiage I like to use with patients, I'm like, the good news is you get to come back in and see us again and spend some more time with us, and your only investment is going to be time, and we're going to get this to the standard that we want it to be. I've never had patients don't care if you're perfect, they care that you want that outcome and that you care about them. Once they feel that, they'll come back in.
Yeah, and I think it goes in the recruiting is where it all starts. And as you embark on this, they're going to do a personality assessment to really understand their true values, the underneath emotional values that will match up with you as business owners, because they're going to become your partner. You have to look at it as a partnership. So they have to align with your values. They're not going to be all, but we can now have personality tests, which are called the NEO. Fantastic test if you ever used it. It saved me hundreds of thousands of dollars and probably countless hours of sleepless nights of hiring the right people. And when you do that, you get the emotional stability and alignment of values, which is number one. And then you spoke about the quality of their care. So, having them come in and work on families or underprivileged people, and actually seeing their work and identifying their work, seeing their hands. Also the integration of that, putting with a senior assistant. There's a way to make sure that the quality is there. So, their hands, how do their hands? Looking at their speed, like how does it take them 6 hours to, cut a crown? Really getting into the skill set. Then there's the culture fit, taking them out to dinner and going around the table and saying, here's who I am, here's something surprising or shocking with me. Like if you're like a fun team and you have a shutdown dentist, that's going to be a little tough on them. It's going to be hard for them to go inside, the room.
The worst thing you can have is if the team isn't supporting that doctor, because as soon as the doctor walks out of the room, the first thing the patient does is look at the ninja, look at the hygienist, and ask, what just happened? Is this a good idea? And if you have a team member going, yeah, I trust that doctor, and I would totally do that, it's not going to work.
Yeah, it's game over. So really setting up the associate to partner for success, and knowing all these elements happen. There's due diligence that you can do on the front end, which we talk about, and you have the steps to get there. And then once they're there, then managing it and being a stand and being a support for that person, because they're going to help duplicate the work that you're committed to doing. So that's big deal. Anything else about associates? Because that's really where we're looking at. We're looking at multiple units now, and we're looking at associates. Any other thoughts that you have as you embark on this journey ahead?
Just that this is something that has to change in dentistry, because we eat our young. Like we literally take young dentists and throw them to the wolves, and it doesn't work. there is a way that we can bring along young dentists and make them successful and make patients healthier at the same time. And it has to be better than what we've been doing for the last couple of decades.
Now, Steve and I are doing this because we're on a mission to get 20,000 dentists to be thriving. And we know that when you go to corporate dentistry, there's a place for that, and some people can operate in those areas, and that's fine. But I have a personal belief that the private practitioner in group practices is the way of the future. And if you're not a true business owner, but you want to be a part business owner, it's a nice way to, live under your abilities to run a business, but also have them partner in your strength and get a talented dentist that wants to be a part of something bigger, but not a part of something that is focused on shareholder value, something that's actually focused on the community of serving North Arlington in Ohio. So as we close out today, what would you like to tell couples about work-life balance and having it all? The word "and" versus "or." What wisdom can you share with that?
So you actually touched on something that's a pet peeve of mine, which is work-life balance.
Yeah.
I think it's a flawed concept.
Good.
I think what everybody really wants is work-life integration.
Good.
And to know that the time, our only non-replenishable resource is time, and we want to know that anywhere where we invest that time it's worth it. And so. That's what we're all after, and so it's knowing that you're doing meaningful work when you're at work, and that when you can leave work, you're having meaningful time at home, and that sacrifice is worth it.
And I think the big thing is having boundaries for sure, especially when a husband and wife team working together. You have to have a time to shut down when you get home. So
it's great being married and working a business together because. I mean, we're building a house right now, and like everybody talks about how stressful that is, and we're kind of like, whatever, dude.
we can handle it.
We've already done all that kind of stuff. But the skills that we've developed here as business partners have helped us be better parents. They've helped us as a couple. You're always wearing those different hats, and so the way that we relate to each other in the practice affects the practice, and so the way that we are with each other outside of the practice becomes really important because that's something that's there, and so it kind of forces you to work your stuff out, and so it really helps strengthen the relationship. From a strategy standpoint, because it's nice to have tactics, assigning time to talk about things and protecting that time and making that work, and don't do it at home because there's too much other background irritation at home. There's dishes, there's stuff that and so when you want to have a serious conversation, go someplace else and really build that time in. And then the other thing that's really helped us, and this is a tactic, is have cash on hand. We were really frugal for the first couple of years, and when you have that cushion, it gives you headspace to be able to breathe.
Yes.
The year that we were down, we didn't change our income. The practice was just down because we had enough of a cushion built in the practice and enough of a cushion built into our life that we could do that. That takes a lot of stress off, and it gives you a chance to have other conversations.
That's great.
Very well said. Yeah, I mean that's amazing. Yeah.
Bring us home, Steve.
Well, we've traveled around. We've seen a lot of different practices, a lot of different models, and I think you guys, we started out talking about being married to the practice and eat, play, love, and I think so. What came through to me was you really do live that. You talked about boundaries, you talked about times, and I think there are a lot of people who will watch this and not even think about that and say, oh my gosh, that's a pretty good idea. Instead of being grumpy all night, 6 o'clock we cut it off, especially when you have two great kids and you have to make room for that. But I've said there are 200,000 dental practices in America, and I think there are 200,000 different business models. And there are a lot of commonalities, and this is one. So I want to thank you guys for inviting us in. I mean, it's just you got a great practice, a great partnership, true partnership, and just really awesome people. Yeah.
Yeah, this is called Behind the Mask, like the whole journey of all these mini documentaries that we're doing called Behind the Mask, and we set out to create people. Real dentists, real people that are doing real things and deal with real issues. And we thought about you guys first because who you are and how you live your life, and what I love about it is you don't think you do,
Right.
And that's what makes it even more grand. And you continue to do the work that it takes. This success and this groundedness and this experience that you live in, you work at. It's not something you just check a box at. You don't mail it in, and it takes work, but it's worth it because you have in my opinion, everything. Each other, beautiful children. You know, how do we define success? You know, is it money? Is it relationship? I think it's connection and purpose, and what are we leaving behind? And then, yeah, we should have money to do the things we want to do, and then share it with people, and then help people, you know, along the way. And you do all of that. And I love the fact that you're successful, and now you're going to uber successful. You're ready to take it to the next level, to another plane, and you're preparing to do that. And so thank you for, you know, taking the mask off and being honest, and also sharing wisdom that only you could share, to have people that are living in your world, and they see hope when they hear what you've been able to do and how you've done it. So I'm forever grateful to you both. I think you're extraordinary human beings, and I'm very grateful to be here today, so thank you.
Thank you.
Thank you.
Yeah.
Yeah.